Fresno County's teen pregnancy rate continues to be much higher than the national average, and with many STDs on the rise, sex education is no laughing matter. But leave it to a former stand-up comedian and now OBGYN to have a serious sit-down talk with teens about sex.
Not many women can say that their doctor is a former stand-up comedian and professional disco dancer, but there are not many women like Dr. Pam Iminy. Dr. Iminy, an OBGYN, has many talents, but her passion is practicing medicine and helping teens.
There's a lot of people that don't take care of teens as far as OBGYN physicians. They're uncomfortable taking care of teens. Teens a time when they're developing their own sexuality, experimenting, and they're very difficult to deal with. They're drama queens. You never can trust them. Can't turn your back on them. And they're kind of high maintenance, so a lot of OBGYN won't take care of them. I am still a drama queen, and so I find them terribly amusing.
With teen pregnancy and many STDs on the rise in Fresno County, Dr. Iminy's skills are needed in the valley.
A couple statistics that are really pretty shocking is 75% of adolescents under 18 are sexually active before they become 18. About 20% of adolescent females will talk to their mother about sexuality. So that means 80% are not talking to their family.
Dr. Iminy believes it's important to realize that adolescents are going to become the moms of the future, and we need to teach them about health care.
They need to come to the doctor. They need to get pap smears. They need to get tested for STDs. They need to know that the OBGYN is their friend and not someone to be afraid of. The first time they come to an OBGYN should not be when they're pregnant.
With medical advances like the HPV, human papillomavirus vaccine that protects against cervical cancer, many tweens and teens are encouraged to visit the OBGYN.
Bringing somebody in 10, 11, 12 years of age is appropriate. Most young girls go to pediatricians or to family practice doctors, and they get their throat checked, their ears checked, their viruses treated. And it's reasonable about 10 to 12 to bring them in for their first visit.
Ah Vang, a health educator for the County of Fresno's Department of Health, educates women about pregnancy and STD prevention.
I believe that being a teen is hard enough and challenging enough without adding the responsibilities of parenthood, as well as the stress of possibly having an STD and having to go through the process of curing that.
With 56 out of the 1,000 teens pregnant in Fresno County, it's important for parents to educate their children.
You need to teach your teens that they have the right to say no. That if they are engaging in sex, they need to be, protecting themselves. And if, they need to make sure that their partner, they need to know their partners and know that their partner is STD-free.
While many parents dread the awkward sex talk with their child, the role of sex education is sometimes more comfortable for both parent and child when given by a doctor.
Take them to an OBGYN. Leave them alone with the doctor so that the child can ask whatever questions they want. Parents often feel like they're being supportive by staying in the room, but that inhibits the child from being able to ask questions.
Dr. Conrad Chow, Chief of Obstetrics and Gynecology at UCSF Fresno Medical Education Program, helped bring Dr. Iminy to the Valley.
The University Centers of Excellence are a group of private practices that are staffed by the faculty of the University of California at San Francisco Fresno Medical Education Program. A lot of people aren't aware that we actually have a medical school here in Fresno, and we are the faculty, so we are the teachers of the medical students and the postgraduate medical trainees.
Both of these doctors want people to know that these faculty physicians see patients, whatever their needs.
Some patients have a lot of needs. They need home health, they need medication, they need close supervision. We can provide that. If you want to come in once a year for your pap smear and your birth control pills, we can provide that. So pretty much any service and any financial situation, we can help you with it. And that's what our goal is here.
And Dr. Chow says the goal in bringing Dr. Iminy here was to fill a need here in the Valley.
The special area that Dr. Emeney brings to us, and really to Fresno in general, is that she has a special interest and expertise in adolescent gynecology and adolescent obstetrics. And there are very few resources for girls who really all need this kind of care. And there's very few resources in Fresno, so we're really excited that she came to join us here in Fresno.
Babies actually will steal from mom. They will take your iron, they will take your sugar, they will take your protein. and they'll keep doing it till they're 21 years of age. So.
Dr. Eminy's special expertise is a tremendous asset to UCSF Fresno, and she is sure to help many teens and parents in the Valley.